Good morning, everyone. Thank you for joining the SPOR and XEVMPD status update webinar. We will now start the session with a few housekeeping notes. Just to remind everyone, please note that this session today is being recorded and will be made available through the EMA corporate website and EMA YouTube channel. Of course, you don't see the interaction with online participants, but at certain points through the meeting, participants will be able to ask questions or give their input via the interaction tool Slido. Interaction with this tool is voluntary, and of course you may opt to remain anonymous, but if you choose to use Slido and give us your personal data, you are hereby consenting of the processing of that personal data as explained in our privacy statement for Slido. You can interact with us by asking questions and giving your input via the Slido tool. The code is displayed there, and you will see that same code at the bottom of each slide throughout the presentation. So that's how you dial into the relevant Slido questionnaire. Please send and upvote your questions, the questions you want to hear answered, and we will be taking the top voted questions that haven't been answered throughout the session and going over them orally at the end of each part of the webinar. We tend to have a high volume of questions and questions not necessarily relevant to the particular session of the webinar. So we do appreciate if you help us curate the questions a little bit. We will be taking questions on each relevant session. So if you have a question on OMS, we would appreciate if you could use one of the following labels and tag it as OMS or tag it as PMS, tag it as RMS, and so on, because we will be looking at those labels to select the questions that we will display on screen and that we will take via the relevant live Q&A session. So please help us curate the volume of questions by labeling the questions to the relevant sections of the webinar. We will do that ourselves, but of course, to make sure that it's really accurate, we would appreciate your help. The webinar materials, the presentation will be available in the SPOR portal documents as previous webinars, as well as the EMA events webpage, and the recording will be available at EMA YouTube channel, as well as EMA events webpage as previous webinars. Next. So today, and for those of you who are not yet familiar with this format, we tend to do a short-term status update on what we've been up in the previous quarter in the different domains of SPOR, as well as what are the planned changes for the next quarter and what we foresee would be the benefits and impacts to users. So this is a point-in-time snapshot of what we've just done and what we plan to do in the next quarter to keep our users up to date. And today, the agenda, I just went over the welcome and housekeeping notes. We start with a bit overview of how SPOR XEVMPD objectives are aligned for this quarter, and you will hear all about what we're doing to engage better with our customers. Then we move on to different topic domain updates, starting with SMS, OMS, RMS, XEVMPD, and yes, PMS as well. And we recap with a little bit of conclusions, and there's a few minutes left if there's any outstanding questions that we haven't yet addressed. So on that note, I now hand over to the next part and giving you an overview of what we plan to do on SPOR, XEVMPD, and PMS in the next quarter. So next slide, please. So we have been looking patiently and quietly to the information we receive in tickets, feedback in Slido, previous webinars, all the webinars. And so far, we believe that we are delivering efficient and effective regulatory data management services on SONR. And therefore, our goal is to maintain those same services. We don't foresee that there's any specific fire or emergency to be handled. So our priority is to maintain the level of services that we've done for SOR XEVMPD in the near future. You may have noticed in previous webinars that we just finished what we called a knowledge transfer for our IT supplier. Every now and again, we have these procurement cycles, and we've also published a public information notice that we will be retendering our data management services in the near future. So in the back end, another priority for the team is to prepare for the data management tender and possibly prepare for for a knowledge transfer of suppliers if that comes to fruition. Where we will be modernizing data and information services is specifically on the area of XEVMPD and PMS. So no surprise there. We have a series of actions that we've asked companies to perform on XEVMPD, to perform on VMS. And in terms of data management services, that's where we're putting our priority. And not to forget, we also want always to improve the customer satisfaction. Last webinar, last quarter, we launched a series of Slido questions to you. We collected feedback from you. And based on the feedback that you gave us 3 months ago, we now will have a series of improvements in how we can increase and engage the engagement with you via dedicated webinars, communication, surveys, and so on. So to recap, we are delivering efficient and effective regulatory data management services, maintaining status quo on S, O, and R domains. We are improving and focusing and putting most of our capacity and priority on improving the way we deal with product data. And in parallel, we're looking out how can we keep a constant and open communication with our customers. So that is the priority of Q3. You will hear more details about it from the different colleagues of the different domains. And I will summarize again at the end what are the exact activities we're doing to pursue these objectives. So now focusing on the customer engagement, I will now hand over to Katarina, who will talk to you how you can stay connected to the work on SPOR and where you can find more information. So Katarina.
Thank you very much, Isabel. So good morning, everyone. I am Katerina Scarpati from SPOR Change Management Team. And today I'm going to provide you with an overview of the different ways you can stay connected on SPOR and XEVMPD. Some of those are you're already familiar with, and some of them you will see are new. So you can find different types of resources according to whether you're looking for latest updates. So if you're looking for be informed on latest updates in terms of development on the different SPOR services, so SMS, PMS, XEVMPD, OMS, RMS, you have the status update webinars like today's one. So it's now more than a year that we launched this format, and it's proven to be really appreciated by the audience. So we're continuing that. And what is new this year is that we will also have a SPOR status update webinar in October. You can actually also subscribe to the Product Lifecycle Management Insights newsletter. That features also some general SPOR news and an overview of public SPOR events that are upcoming in the next quarter. The next issue will actually be released pretty soon, by the end of the week, maximum next week. So make sure to subscribe to that so you can receive it directly in your inbox. Then, if you're looking for live answers to your questions, we have now launched a new activity, which will be launched actually in September, but you can already register, which is the monthly Q&A clinic format. This has proven to be successful with one of the SPOR services, which is PMS. The PMS team has started to do monthly Q&A clinics since February this year. And we saw that this format really helped users to get their most frequent questions addressed pretty quickly. So we have launched a similar format for SOR services every second Monday of the month, and a separate session always monthly for XEVMPD. And the XEVMPD sessions will take place on the same day of the PMS Q&A clinic sessions, still monthly. So all information is available on the EMA website, and you can register there to the WebEx sessions. And for now, the sessions are planned until December, but please note that if we see that there is appreciation from the audience, we are likely to extend this period also in 2026. Then, if you're looking for training materials, you can now consult a really practical YouTube library with that will serve for you as a repository of all SPOR webinars. I will go more in detail later on that. Then lastly, if you would like to share your feedback, we will launch this year, as in previous years, the SPOR customer satisfaction survey, though there will be a little changes in the format that I will explain to you in a minute. So if we can go to the next slide. So here we have a focus on the SPOR video library, and you can see what it looks like. But now actually I will also share my screen just to give you a really brief overview. As you can see, I'm here on EMA's YouTube channel. Basically, if you just go to the landing page of the channel, you just click on playlists, and just here at the top, you see the SPOR webinars playlist. If you click here, what you reach is this page. And you can see that we have renamed all the videos so that it's easier for you to retrieve both all the status update webinars recordings. Okay, you see, starting from the very first one we had on 10 April 2024. And here you have the recordings of all the latest webinars of SPOR Webinars Week in 2024. And you can always consult this. The information is up to date. And in these recordings, you can find for each SPOR service an overview of what's there and the available guidance resources for each service. I just have one last slide. Because as I was mentioning earlier, we will also have some changes in the format of the SPOR customer satisfaction survey. So in the next slide, we can see an overview of the customer satisfaction survey current and the proposed new format. Just as a reminder, the survey's main goals are to monitor the performance of the different SPOR services and improvement areas and the trends in the satisfaction, because when we compare, we always compare across services and across different dimensions of satisfaction. And we also, of course, compare data with a previous year's survey. So what will change? First of all, cadence. The survey, as you're aware of, if you've been a SPOR user for a while now, it is conducted once a year. The proposal is to now conduct this quarterly. The target audience will not change. We are targeting SPOR users. The distribution channel will change. So for now, we send usually once a year individual emails via EU survey to all the list of registered SPOR users. So we retrieve this via our platform data. While now the proposal is to shift to a Slido public link that will be published on EMA website and the SPOR portal. And of course, we will also advertise this during the SPOR status update webinar. So the idea is that each quarter we'll launch the new survey during the SPOR status update webinar, and then it stays open for a while. The question types also will change, usually also to allow better comparison. We use the same questions every year. Now the proposal is, of course, to have some standard questions to allow comparability. But according to the feedback we get, maybe we may see that there are some aspects that we would like to investigate on a bit more. So a few questions may be subject to change. Okay, so that was all concerning SPOR engagement. you with an overview of all the available resources, old and new. And of course, you will be able to consult the slides to be able to access all the links that are embedded in the slides. Thank you. And yeah, I leave over to Isabel for the rest. Thank you.
So I think now we were supposed to go through questions, but doing a quick look through Slido, I see already domain-specific questions for OMS, for SMS, for PMS, so we will address them later on. Now, I would like to address any engagement questions. So if you have, I'll give you a couple minutes just to launch to see if there's any particular engagement communication question that you would like to see addressed. So in short, what we're trying to do is become a little bit more agile in how we engage with you. We're going to keep these quarterly updates, frequent updates of what we're doing, what we've done, what we're going to do next. You can come and ask us any questions. We will have monthly opportunities for you to come and ask us any domain-specific questions you want to see addressed. And at the moment, what we're kind of pausing is the full SPOR week, where we had more of a training focus, going through everything for each individual domain and training users on how to use that. Instead, we have organized online materials, so you'll find them if you require training on any specific SPOR domain. And of course, you can still use the other events to ask us questions if that's still not sufficient. So we're investing more on more frequent engagement and improved the training material that we made available to you. So that's what we're doing in terms of engagement. And in terms of feedback from you, instead of doing a 1 year round, give us your feedback on SPOR, we will also do that quarterly to collect more feedback. We won't be always comparing, but we will be reacting to the feedback that you give us in that customer satisfaction survey to use that as input for the next quarter planning. So we hope that way we can become more receptive to your feedback and more agile in the way that we implement it. So do you have any questions on that? And I will quickly just go and look at Slido. I think they're very domain specific.
Yeah, so I just saw one question on the YouTube channel link. Just to clarify, we've shared the link, but in general, you just need to go to YouTube and you can just type European Medicines Agency and you are directed to a channel.
So I propose we move on, and I think the next is SMS update. We can always revisit if there's questions at the end. Pedro, off to you.
Thank you. Good morning, everyone. My name is Pedro Batista. I'm the SMS business lead, and I'll be giving you a brief update on the activities from SMS that have been completed, are ongoing, or are planned to be done. So, starting at the top of the slide, we have the usual data management activities, so our data enrichment exercises that we have been performing for quite some time, so no changes here. We will continue to address new INNs, USANs, UNI, and the European Pharmacopoeia data enrichments as soon as these sources update with new data. And we will continue on a quarterly basis with the custom attributes regarding the substance role in human products. So this is something that we started in the previous quarter, and we are continuing every quarter. And then later in the year, we have the yearly enrichment related to the Union List of Critical Medicines. So overall, there's been no changes in this group of tasks. Now, in data quality, here the plan has been changed considerably. So we have a new task that was not foreseen regarding cleansing and enrichment of Norwegian translations. I will be explaining it soon. the main focus in terms of cleansing now is the herbals and also the fungi and the animals. And after this group of substances is cleansed, then we will try to start with the homeopathics, which are directly related to the herbals. But we have to pause two cleansing activities. So the one on human vaccines that we had been working on it for quite some months already, but this will have to be on pause, and also the cleansing of the duplicates that have the SVG flag 0. This is due to our other priorities that Isabel has mentioned, so we had to scale down some cleansing activities. Then in terms of documentation, we'll continue with the regular updates of the SMS guidance, and the next update will likely contain the outcome of the cleansing of herbals. And in terms of awareness and visibility, so we'll have the events and sessions that Katarina has just mentioned. And lastly, on the information management modernization, we have completed the knowledge transfer for a new IT supplier, but now we have a new big activity, which is the upgrade of our system that is the base of SPOR, which is Informatica. So there is a version upgrade due. So this will also be our next big priority. Next slide, please. So now focusing on the tasks that have been completed in the past quarter. So we have this unplanned task related to the Norwegian translations. So this was a data cleansing and data enrichment initiative by the Norwegian Medicines Agency. So they have been going through all the translations related to Norwegian in SMS and comparing with the Norwegian database. And the outcome of this was all the translations that were in SMS have now been reviewed. And in addition, the missing translations have now been added. So this was a very valuable exercise that we are very grateful to the Norwegian Medicines Agency because it was the first time that we have performed the cleansing exercise at translations level. So all the cleansing exercises that we have done in the past years, they have all been done at substance level, so with a focus in the names in English. So this was the first time that we actually addressed one language end-to-end, and not only cleansing, but also enriching with missing data. And yeah, now we are confident in the high quality of Norwegian translations in SMS. We are discussing a maintenance process to ensure that this level of quality is maintained. And we are hoping in the future to have similar exercises with other NCAs to cover also all the remaining languages of translations in SMS. Then I've also mentioned we have completed the knowledge transfer to a new IT supplier. So last year, our previous contract with the previous supplier finished. There was a tender launched and a new supplier has been selected. And for the past months, we have been focusing on knowledge transfer. And now we are in the phase of reprioritization of the backlog related to SMS, OMS, and RMS. So the consequence for SMS is what we had planned last year, mainly in terms of improvements for the SMS exports in the SPOR portal. So now they are a bit delayed for the coming quarters, and our internal new functionalities that we were hoping to get are also a bit delayed. And once we have more information on these timelines, then we will also communicate them to you in a future webinar. So next slide, please. So now in terms of what we are planning to do for the next quarter, the main data cleansing exercise is related to the herbals, so mainly plants, but we will also want to cover the fungi and the animals. And the reason to start with this one, it's because it's a quick win. So it's not a very complex group of substances. It's easy to cleanse, and it's also easy to outsource. And also, this group of substances, they serve as parent substances of the homeopathics and the herbal extracts. So first we'll cleanse this one, and then we can address the homeopathics afterwards and the herbal extracts in the future. So there's been a very extensive pre-cleansing exercise done in SMS. We are hoping to start the discussions with the SVG on this topic very soon in the coming weeks. And since this is not a very complex group of substances, we think that it can be completed still within the Q3. In parallel to this, there's the iterative versions of the SMS guidance that I had already mentioned, that it was our new strategy for this year to ensure that we have more frequent versions of this guidance instead of just once a year. So once we are done with the cleansing of the herbals, then there will be a new version that will describe the rules of the herbals, maybe a few other substance types, and a few other modifications of the guidance that are deemed required at that stage. And then we will also start this quarter the SPOR question and answer clinics that Katarina had mentioned. So the first one will be on the 8th of September. So it will be a chance for you to come and ask us questions about SMS and also OMS and RMS. So next slide, please. So this is just a summary of what I've just presented. In terms of what has been completed was the cleansing and enrichment of Norwegian translations and the knowledge transfer for our new IT supplier. Our main focus of ongoing work right now is the herbals and fungi and animal cleansing, and continuing to update the SMS guidance with additional versions. For the later period, we will try to start with the homeopathic cleansing and perform the upgrading version of our SPOR system, Informatica. And the two big tasks that we had to put on hold is the human vaccines and addressing the duplicates with SVG Flag 0. So that was my presentation. We will now change to Slido to see if there's any questions to be addressed.
We will make sure that the one on top will always be a domain-related question. So although the rest it's not, but the one in light blue will be the one to go. Thank you.
Okay. So I will be addressing the question on top. Can you please provide the update on what are the pending issues for vaccine cleansing that have been paused? So here is really just time constraint. So human vaccines, it's a very complex group of substances. It requires very extensive analysis, and many discussions are needed with the substance validation group. Probably all the substances that all the vaccines that we have in SMS will have to have a change in preferred term, and that is not technically possible at the moment. There might be many new vaccines records that will need to be created with different levels of granularity. It will require relinking many products in XEVMPD, which will then impact PMS. So it's both the scientific complexity of this substance group plus all the data management impacts in all the consuming systems. And considering our time constraints at the moment and all the complexity around this group of substances, we had decided to focus on more simpler groups of substances that can be addressed quicker and with less resources and less impacts around, and then at a later stage addressing this more complex group of substances. As the cleansing activities for substances apart from human vaccines using SVG flag finished? No. So we are about halfway of all the SMS list. So we did the chemicals, we did proprietary excipient, so the color con and related substances. We did the veterinary vaccines. We did the most used proteins and polymers. But that's pretty much what has been done so far. So we are missing the herbals, we are missing the human vaccines, the homeopathics, herbal extracts, gene therapy, cell therapy, some mixtures. So there's still about half of the SMS records that are not yet cleansed. The ones that are mainly used in approved human products have been cleansed. So there's a small subset of those missing, but there's many substances that are only at clinical trial stage or scientific advice or orphan designation or are just reported in an ICSR. So those groups of substances, they have not been started yet. Will the SVG flag duplicate cleansing completed by end of 2025? I think this question was probably before I presented it. So the answer is no. So the activity is on hold for this year. So this also has a lot of impacts in consuming systems. So it will require relinking all products in XEVMPD to the replacement substance, which would have an impact in PMS, in IRIS, in pharmacovigilance. So it's also a very complex task, and it will not be done this year. So this would have to be for next year. As of what time can data enrichment for API herbals be performed? Is there also bulk update possible? I'm not sure what data enrichment is this referring to. So if you could provide more information on this. We are now focusing on data cleansing of the herbal substances, so the substance records related to plants in SMS, but I'm not sure what this question actually refers to. If the SMS cleansing is on hold, what do you recommend action for industry regarding internal systems cleansing and XEVMPD product updates? So the recommendation is the same as before. If you see a substance with SVG flag 0, then you should not use it, and you should refer to the replacement substance. So we are not nullifying the substance with the SVG flag 0 now, but it will be nullified at some point. So if you start the relinking of products, or at least avoiding using the substances with SVG flag 0 for the new products, then you are facilitating your life and our life in the future, because at some point those products will have to be relinked so that we can nullify the duplicates. So as a minimum, you should avoid it for the new products, and for the already existing products, it's up to you if you want to start that now or a bit later, but they will have to be relinked at some point. If we perform the replacement of substances from SVG flag 0 to flag 1 last year, do we have to periodically check that flag of our substance remains 1? In general, it should remain 1. So there's been only a handful of cases of a substance that had SVG flag 1, and then it was later reverted to SVG flag 0. So while this is not an impossible scenario, it's an extremely unlikely scenario. So if you have already made that correction last year, I would say that now you don't have to worry about it for this year. And then next year, when we have concrete timelines of our plans to relink the products and nullify the substances, then at that stage, maybe you can check again. But until next year, you don't need to check it. When will be available reviewed substance referred to SVG blank? So I suppose this question is about the substances that do not have the SVG flag 0. So this, I think I already mentioned. So we are about 50% of substances cleansed, so about 50% have SVG flag 1 or 0, about other half does not have SVG flag yet. For this year, we'll be trying to address all the herbals, and if time allows, at least some homeopathics, so that will increase the percentage of cleansing to maybe 60% by the end of the year, and then that would still leave 40% outstanding for the coming years. Does the substance comment box appear to be unspecified? Is there a way to change the substance that contains the statement? So there's a small group of substances in SMS that have this comment, unspecified. So these are substances that do not contain the level of granularity that we would like to have. So, and this requirement comes mainly from the European Pharmacopoeia. So these substances should not be used for new products, but for some products, they were approved like this. So the SMPC does not have the information that we would like to have. So for the old products, they can continue to use these unspecified substances. For new products, then they should not use these unspecified substances, and they should use a more specific substance with a correct level of granularity. And if an applicant needs additional information and additional guidance for a particular unspecified substance, what they should use in a specific product, and then they should create a ticket in the EMA service desk, and we will try to provide some guidance more tailored to that particular case.
Pedro, I still see that there's some SMS questions, but I see we're accumulating a lot of PMS XEVMPD questions. So we will be moving on to the next parts of the webinar. Pedro can still address some of the questions in writing while other colleagues are presenting. And if we have time, we can circle back to any relevant SMS question. Sure. So in the interest of time, I suggest we move on to OMS with Deborah now. And just a heads up, I've seen already a lot of questions on XEVMPD and PMS. Just to manage a little bit of expectations, I do not believe we may have time to go over all of them. So I do recommend that colleagues read the questions already there and the answers already there. And of course, there's always the opportunity of the monthly clinics that we will be launching to address questions. But for today, please see if the question you're looking is already available before sending more, because we already have a lot of questions in the backlog.
So over to the OMS status update, what we've done so far and what we plan on doing in the coming quarters. So we will, for the in terms of customer service, towards the end of the year, we're going to do again our yearly review of our FAQ and any knowledge articles available in service desk. In terms of data management, with the launch of the new version comment feature, next week we aim to start this new process. We will start enriching our new versions with this comment version, but we'll see a little bit more in the coming slide. Still under data management, towards the end of the year, we plan to expand OMS contact network. We'll start with trying to reach out to National Postal Service to help us resolve any open tickets that we may have referring to any locations, or even to have this network, to build this network for any future requests we may have related to our data quality. Moving on into the data quality, we'll continue our work into maintaining our data quality profiles. This helps us identify and ensuring we keep the quality of our data. Still in the upcoming quarter, we want to finally start the impact assessment on the legal entity types. These were a set of rules that, as you know, the OMS data quality rules were created before 2016, and we've identified some deviations to the current business rules available in each national business registry. This is why at the moment we're doing a massive review. Basically, we're reviewing all legal entity types to all EEA countries, and we're trying to identify these differences. And later on, we'll take it to the key user group for an impact assessment, try to understand if it makes sense to change them or not. And then depending on this impact assessment, to implement the changes if this is the outcome of the key user group assessment. In terms of documentation, we will see a little bit into more detail what is this policy we want to create, but basically we want to create a new policy on the use of alternative names. In terms of still under documentation, we want to do a review to our category document, which is the vocabulary catalog. That's the name of the document in our OMS portal. This is a document that has been published for some time now, and we deem necessary to do a review, an urgent review at this point. And if time allows, towards the end of the year, the document that has been in our wish list for some time now, which is to create a detailed guidance on how the OMS merges work. In terms of awareness and visibility, basically our webinars. So just Pedro already guided you through this. Is here we will have the same webinars, but just to highlight the clinics that we will be starting in September. In terms of information management initiatives, as Pedro already mentioned, we recently concluded the knowledge transfer to a new IT supplier. Next, all our efforts will be put into an upgrade that needs to happen, an upgrade to our Informatic MDM system, which is our backend system. And this is an upgrade that needs to take place during this year. The version comment, which is a popular that OMS has been talking for some time about this, but this is going live next week. And towards the end of the year, if time allows, also coming back to the return change request feature. But going back to the version reason, so we send on the 1st of July, we send a notification to all API users that this feature will go live on the 6th at the end of a working day. So after 6, we're planning to do a production deployment on the 16th of July. So this feature the aim of this feature is to increase the transparency for the reason and exactly what changed with each new version created. So this will help. This will help all users create a better tracking and facilitate the management of all versions that occur in OMS. Be any test you need to do, any integration if you're using the API, this needs to happen as we speak. You can use the current UAT environment to perform any of those testings, since this feature is today in the UAT environment. The implementation will be a two-phased approach implementation, one which will take place next Wednesday in exactly 1 week time, where we will be implementing this feature in the API, in our backend system and in the API. And the second implementation will occur, we don't have a date yet, but will occur a couple of weeks later, where we will make this version information also available in the OMS exports. For those frequent users to OMS, you were aware of all the exports and how a different version to see the data. So these versions will not be available in the Web UI portal, but you will be able to consult them once we implement this phase 2 in the Excels we have available. Moving on into what's coming for the next quarter, as I already touched base, we want to create a new policy on alternative names. This was due to we realized that it's unclear how we manage this data, the rules that they apply to this specific field, and of course to help not only the users, but any consuming systems clarify the rules and potentially apply some changes if necessary, depending. Hopefully, this policy will help systems with this. How and when will this happen? So we will internally have a draft, and then we'll take it to the user group to help us define the scope and the focus of this policy. Moving on into the SPOR clinics, into the SOAR clinics. So this is a new feature that you'll see us. So with this, we aim to bring us together to our users and to provide an opportunity for for you to ask us directly any question that you may have related with substance organizations or referentials. These clinics will start in September, and it's going to happen on a monthly basis. Also, a piece of an upcoming good news. So also next week, the Spanish NCA will start consuming OMS on a mandatory basis, not to all procedures, but to two main scopes, to applications for new registrations and marketing authorization variations for national products, and for applications for national codes for centralized authorized medicines and those variations applicable to those same products. In short, highlights. So version reason will go into production next week. The knowledge transfer officially concluded to the new provider. Ongoing work, we have the upgrade, the return feature, and the review to those organization legal entity types. And in the future, we will pick it up, start this policy on alternative names, review the category. And with this, we can move on into the QA time. I'm not sure if we have any, not a lot, but yes, okay. Okay. Few times when marketing authorization holder provide document as evidence as GMP is for addition or update, it is getting rejected as it is not available in some of Red Book's phone directory, and ask marketing authorization to ask org and log to get its address added to the book. So here we need to take a huge step back to our OMS key principles. So I'm assuming here you're talking at location level and not such as organization validation level. So what happened is that OMS maintains the data as it is published in the National Postal Service data. In this case, I'm talking location data. What happens often is that certain inspections, certain GMP certificates, they occur not in one single place, one physical place in the map, but to an area, to multiple buildings. And this, at OMS level, this cannot be maintained. For other GMDP, there is a guidance that was provided by other GMDP colleagues when OMS became mandatory in the system, which is when an inspector or a company is facing this case, that an inspection occurred to an area and not to one single point in a map, the inspector need to make use of the remarks section available in the other GMDP certificates to highlight any other door numbers that have been included in the inspection. OMS, remember that OMS, it's a master data management dictionary. So we feed information not only to other GMDP, but also to other systems. All regulatory EMA regulatory procedures are now using OMS also on a mandatory basis, and creating one physical, one lock ID to represent one inspection. This would not comply with our data quality standards, where we have one location. It represents one physical point in a map. It represents one physical location. Any extra details relevant to any regulatory procedure, or in this case to an inspection, it needs to be maintained separately under the remarks section. When will OMS? Yeah, this one. Yeah.
So I think we have already answered this, but just one point here. These are not OMS issues. And I want to make this clear. These are not OMS issues. These are issues on how consuming systems are taking the OMS data, and we are discussing internally how this is going to be fixed. There is a plan, but we don't have timelines yet. So as soon as we have any concrete plan, we will make it available. But there is no public plan that we can make available now.
Can you give information about the alternative names in OMS? When should it be used? Can we add organization from the proof of establishment? So this is why we need to create the policy, exactly to answer all these questions. But for the moment, what we're doing is if we are able to find exactly in this proof of establishment that a business name is under a certain legal entity, or if the company wishes, we can add this alternative name. If you have a business name and you have proof from the National Business Registry that is a business name of a certain entity, we are happy to add this as an alternative name. Something that we also use this alternative name field is because OMS maintains the name with English character sets. For example, countries as Greece, they have their own Cyrillic characters, and in those cases, for example, what we do is we maintain the English version without accents, without any special characters as a main, and this is one of the times that we use alternative names to save this type of information. But more information will come with the creation of this policy. You mentioned that the Spanish NCA will make OMS mandatory for new MA variation. This new requirement is mandatory for vet vaccines and human vaccines, or only. So, from what we understood, this, yeah.
Just maybe to share that we've published the presentation, and on the slide that Deborah showed, there's a link to the news item from the Spanish NCA, and I was just reading it. It's in Spanish.
Yeah.
You can use Google Translate.
Yeah.
But it does seem to indicate that it's only human products. So I'm sorry, we're just passing on the news. There's more information on the Spanish website, and of course, please consult them if there's questions on what exactly they require.
The scope. Yeah.
We're just kind of bringing to your attention, this will come into fruition very soon. So please contact them and watch out for that.
Okay, then with this, I think we concluded the OMS questions. We'll move on to RMS. Yeah, Jaume?
Hello, good morning, everyone. My name is Jaume Gonzalez. I'm the business lead for RMS, and I'll be happy to provide you with an update on the RMS activities. So my colleagues in the room are just telling me I'll just go ahead. So hopefully we can make this work. So
yes, all good, Jaume. Sorry, you can.
Oh, okay.
Thank you.
Excellent. Thank you. So if we look at the overall plan, on the data management front, last quarter we started the analysis to create a bulk update process for the EMDN list, which is a catalog of medical devices owned by the European Commission. And this is planned to last at least until the end of the year. In addition, and as of the second quarter of this year, we are providing enhanced support for ATC translations. So any NCAs needing national translations for the ATC list, they can contact us and we can help with that. In terms of data quality, there are a lot of activities, as you can see on your screens. Last quarter, we reviewed and updated the units of measurements list from RMS, and I will give more details on this on the next slide. And we started the process to review the content of 3 important lists in RMS, which are the special precautions for storage, shelf life, and material list. And I will also provide more information on this in one of my slides later. Another activity which also started last quarter and is planned to last until the end of the present quarter is the update of the vet variation classification. and the publication of the medical devices list, also known as EMDN. For the present quarter, we have also planned for the update of the VEDRO list to version 21 and the update of the MEDRO list to version 28.1. And this is following the same update schedule of the relevant list owners. Also planned for Q3 this year is the review of the manufacturing activities, and you will see details of this in another slide. And last but not least, later this quarter, we may resume work to either create or update data quality profiles and data quality reports to improve data quality through actions like adding missing term descriptions, assigning current terms to non-current terms, and other type of enrichments. Now, moving to documentation, the review of list information documents, which started at the beginning of the year, it will continue until the end of the year, and you will see concrete numbers on this later. And something new is the publication of yearly update summaries for the ATC human and the ATC vet lists, which already took place. And the same for the VEDRO list, although this one is expected a bit later, but still within the present quarter. And again, I will provide more details on this in a later slide. In terms of awareness, and this includes all the webinars and clinics, this has already been covered, so I will not touch upon it. And then in terms of modernization activities, last quarter, we started to work on the functionality to see previous versions of RMS terms via the API. And this work is planned to continue until the end of the year, approximately. The Informatica MDM system is planned to be upgraded very soon. So testing is actually planned for this quarter. Another work stream is the upgrade of the RMS portal. And in this respect, there was some work done in the previous quarter. At the moment, this is on hold due to other more urgent activities, but this work is planned to resume probably around the first quarter of 2026, and this will be confirmed as soon as possible. As also mentioned by my colleagues earlier, the knowledge transfer to the new IT supplier was completed in the previous quarter. And last but not least, the analysis of the integration between the MEDRA API and the RMS API is planned to start this quarter. If we can move to the next slide, please. So in terms of work completed last quarter, we reviewed and enriched the units of measurement list as some unit symbols or extended attributes such as unit of measurement type or fraction position were missing. And also there were some incorrect EUCOM codes that we corrected. Now, with this exercise, the data quality and clarity of the list should now be higher. And we expect that the understanding and the use of the terms from this list will be improved, and that there should be less technical issues from consuming systems due to missing or incorrect data. In addition, we continued the review of key list information documents, which was started at the beginning of the year. So initially, 30% of RMS lists were missing this document. And after the publication of the list information document for 10 lists in Q2 2021, the percentage is now down to 21%. This should improve transparency, and it should increase efficiency and awareness of RMS lists, as well as reduce the number of questions that we receive for these RMS lists and submission errors. These 10 lists were completed last quarter, but like I said, the work continues as still 21% of the lists are missing this document. So this will be continuing throughout the year. The other piece of work completed last quarter was the publication in the document section of the RMS portal of a document showing the new terms inserted and the terms updated with the yearly updates of the ATC human and ATC vet lists. And these summaries, by the way, they also show the mappings between the RMS IDs and their corresponding ATC codes. The reason for publishing these summaries is that there is no easy way to identify within the SPOR portal what exactly has changed with these yearly updates. So with this document, we will be increasing transparency and awareness of the exact changes that are taking place. If we can move to the next slide, please. So in this slide, we can see the main activities planned for the present quarter. So concretely, the first item is the update of the VEDRA and the MEDRA lists. You may be aware that VEDRA is updated once yearly, and this is done by EMA. And MEDRA is updated twice yearly by the owner, who is MSSO. And then RMS publishes all of these updates in the RMS portal as soon as possible after the updates are made available. Specifically, VEDRA has already been updated by our vet colleagues at EMA, and MEDRA should be, the next MEDRA release is expected in September. So the expectation is that all of these changes will be reflected in RMS by the end of this quarter. Now, as a result of these operational updates, this list should be complete and up to date, and this should increase the use of these lists, and it should also reduce the number of requests that we receive for new terms or for updated terms. Moving on to the next topic, and after the review of the manufacturing activity list that ended in January this year, and where we looked mainly at short names and descriptions, we are now planning for another review of this list, but this time the focus will be on aliases or other names, which is basically the same thing, as only a few terms of the list have them. And we believe that this may create confusion sometimes, and this may raise questions from users. So the consultation with the already created multidisciplinary group, which is basically the group of subject matter experts for this list, is planned for this quarter. And the updated list and minutes should be published in the RMS portal after completion. With this, we are planning to improve clarity and process efficiency, as aliases should help improve understanding of the terms, and again, reduce the number of questions or rejections for this list. And last but not least, we are also planning to review, as I mentioned, 3 important lists in RMS, which are special precautions for storage, shelf life, and material. This is mainly due to the increasing number of requests received for these lists, and also due to the need to have them ready in RMS to facilitate PMS implementation. So the plan is to first identify subject matter experts within this quarter, because we still don't have a group of experts to review this, to then start the actual review and to implement any agreed changes by the end of this year. And with this review, we hope to provide reassurance to users that lists are fit for purpose, and we will ensure that the selection of referentials in regulatory applications is as straightforward as possible. Moving on to the next and last slide, please. So here you can see a summary of RMS activities. So just to recap, work that has been completed so far is the review and update of the units of measurement list and the publication of the yearly update summaries of the ATC human and ATC vet lists. In terms of ongoing work, we have the update of the variation classification, which is linked to changes in legislation. We are continuing to publish list information documents wherever missing, and we are continuing to provide support to NCAs who need support to add translations to the ATC lists. Changes expected in the near future are the update of the VEDRA and MEDRA lists in RMS, the review of the manufacturing activities, and in particular, the possibility to enrich this list with aliases, the review of the special precautions for storage, shelf life, and materials list, and the work on new or updated data quality profiles. Last but not least, and more in the longer term, we are planning work on the integration of the RMS API and the MEDRA API, the publication of the medical device list, also known as EMDN, as well as the implementation of a bulk update process to ensure future updates of this very same list. So this is it for RMS. I think we can now move to questions, please. Okay, the term one each consumed in XEVMPD is mapped in RMS to item that should be reflected in PMS, but it is not. In PMS is always mapped on box. We got 3 times confirmation on the expected term mapping item. Can you clarify, please? To be completely honest with you, I would need to review this because I know there's been a few ongoing discussions. I think there's also been communications with the DQM. So for this one, if you don't mind, because I don't have the information on top of my mind, I would like to take this one offline because I can't give you an exact answer on this one. But we are aware of this issue. Our SPOR RMS API access has been assigned to a generic account. In order to get this access granted, should we create a company email for this account in order to manage the password reset? Thanks. Not an expert on the API here, but in general, we would always recommend a company email rather than a generic email. So I think that for API purposes or any other business purposes in general, we would certainly recommend that a company email is used.
Just to add, so again, linking it to engagement, we have a dedicated SPOR API webinar published. And that's where we extensively cover the process and the rules to get access to the SPOR API. So we advise you to consult that material. And if you still have questions, please do send us a ticket. I'm afraid we don't have the right technical experts on the API present with us today. So apologies for that. So SPOR API webinar, there's a few slides on that. And if that doesn't work, please contact us via service desk.
Can the NCAs view the amendments of the reviewed lists in advance as track changes, manufacturing activities, units of measurement, special precautions for storage? I mean, in general, if we do one of these consultations with subject matter experts, there would typically be, the experts would typically be from different NCAs. So I would then recommend that anyone interested in seeing this gets in contact with their NCA colleagues who actually make part of this group. Otherwise, the discussions are limited to the group of experts. And then the next step is we already publish the final changes in the SPOR portal. Yeah, that's again for the lists for which there's a clear process that there will be a kind of a consultation with subject matter experts, yeah, which is not the case for all lists. At the last SPOR status update, you mentioned the possibility of an RMS pilot to help NCAs map to RMS lists. Is this not in scope anymore?
I addressed this one in writing. So this is Isabel, head of service. So it's not in scope anymore. We wanted to offer this service as a possibility to all NCAs. But at the moment, due to other priorities that I explained at the beginning, we could not reliably offer that. So that's why it was removed specifically of the plan. If there is a specific NCA who is struggling with mapping, who would require help, please contact me privately. My email is available. It's not private. It's isabel.cicero@ema.europa.eu, and we can see if and how we can help you. But at the moment, we cannot offer full-blown mapping services for all the referential lists for all the NCAs. So apologies for that.
The ATC list includes NCA's ATC, or is it only WHO ATCs? Both ATC human and ATC vet lists in RMS contain only approved ATC codes by WHO. I guess by NCA's ATCs, you refer to the national ATC-like codes. If that's what you're referring to, there's a separate list in RMS that is called National Classification List, which was created precisely to cater for these codes that are not officially approved by WHO, but which are needed anyway there for PMS purposes. So I hope this clarifies. Does RMS offer MEDRA terms for XEVMPD and PMS updates? So the MEDRA terms are in RMS. The MEDRA list is in RMS. It's complete, it's up to date, and it's available for browsing. And you can see the term details individually. What is not possible is for the general public or for industry users to actually download the full list. For that, MSSO, who is the owner of MEDRA, should be contacted.
Sorry, Jaume, maybe to add here. As Jaume said, the RMS, the MEDRA codes are in RMS. They are also available in XEVMPD. And then with this process, so from XEVMPD, there is a map to RMS, and then the terms are shown in PMS, in the API or in the product UI. So this is in a nutshell, the circle on this MEDRA code. So maybe that helps.
Thank you, Marcos.
And that's the last question.
Yes, that's the last question on RMS. We move on to XEVMPD. And again, a little bit of heads up. We already have a lot of questions on XEVMPD and PMS, realistically a lot more than what we can cover on this webinar. Feel free to send us more, but it's unlikely that we will be able to reply to them because the people who will be presenting are the ones who could answer them. So they will not be answering them at the moment. Please do bear with us. So I suggest you vote on the questions that are there. And if your answer is still not addressed, you always have the monthly clinics, and there's monthly clinics on PMS for sure. And we will start XEVMPD monthly clinics as well. So please bear with us. At the moment, we already have a lot of questions, and the two people that can answer them will be presenting, so they cannot be answering them in the meantime.
Thank you, Isabel. Good morning, everyone. My name is Veronica Baker, and I'm an XEVMPD co-lead together with my colleague Marcos, who also leads on PMS. With regards to XEVMPD activities that we have been performing since the beginning of the year, and specifically in Q2 of this year, we continue to review our XEVMPD related questions and answers. As I've mentioned in a previous webinar we had at the start of this year, what we're trying to do is we will review all of these questions and answers which are currently available as a PDF document on our webpage. We will update them to contain the most up-to-date information, and we will try to transpose it as best as we can in articles, knowledge articles in ServiceNow, which is the tool that we use not only for you to submit your questions, requests, and notifications to us through ServiceNow, but we also use it to share this type of information with you before you actually submit a ticket to us. This activity has currently been extended to continue until Q4 2025. So please bear with us. These will be available for you in ServiceNow by the end of this year. In terms of data management and data services, as you are aware, there have been a few XEVMPD submission process changes taking place from the beginning of this year. These are specifically related to the submission of composition as per Module 3, also the availability of marketing authorization pending status, and the change in the MA transfer process. With regards to the composition, I have seen that there is a question on this already, so I will provide some information. Please note that the composition information may still continue to be provided as it is stated in the SMPC. However, it can also be provided as it is stated in Module 3 dossier. Whichever way you decide to provide this information, please note that the information must be provided for all substances within the product, which are referenced in the as per the SMPC or the extract of section 3.2p1 from Module 3, depends on which way you provide this information. And these must be attached to the authorized medicinal product entry as a supporting document, so our validation team can actually check the information in the corresponding document. With regards to the valid pending national phase marketing authorization status, this is applicable to be referenced in medicinal products for which the marketing authorization under MRP or DCP is pending, not for purely national marketing authorizations. And as you are aware, we have had a change in the way you notify an MA transfer between two different organizations registered in Vigilance under different headquarters. As part of the process, the organization that is invalidating the authorized medicinal product entry in the XEVMPD to notify that there was a transfer for that medicinal product has to now reference the new marketing authorization holder in the medicinal product entry that is being invalidated. We continue to provide XEVMPD and PMS mapping services to national competent authorities. There are around 50% of products which we received from national competent authorities already mapped. We foresee to finish this activity and have the NCA PMS data mapped by the end of this year. The start of validation of updated authorized medicinal products in clusters is now foreseen for Q3. However, a little disclaimer here, please know that this may be subject to a change because some other activities may be prioritized, as already highlighted by Isabel. With regards to XEVMPD data quality, again, we continue the data quality review of PMS to support PMS submissions. These are related to authorization numbers and critical medicines. We also perform our centrally approved product information submission compliance checks. With regards to XEVMP documentation, I will provide some further information related to the documents that we will be updating as of Q4 2024 in due course on the next slide. So I will not spend too much time on this at the moment. With regards to awareness and visibility, we have another SPOR update webinar planned for October. And also, as several of my colleagues already mentioned, we are starting to provide a new service, which will be the Q&A clinic, also starting from September. And last but not least, with regards to how we modernize data and information management, as you may have been aware, we have received the approval from our management with regards to developing the new upgraded XEVMPD user interface. Again, I will provide further information on the next slide. Next slide, please. So as I mentioned, we have received approval from management. Therefore, we have started already our work on upgrading the XEVMPD user interface. We have also created a provisional delivery plan. This has been defined, and any update on the progress of the development or on the development of this user interface will be shared with you during the status update webinars. Why are we doing it? we recognize that there is a need to upgrade this user interface to provide you with an improved user experience. As you know, at the moment, you need to have dedicated software provided by the EMA downloaded on your computer. You need to use IE extension in order for you to access it. This will become obsolete as and when this new user interface is up and running, because it will be a browser-based solution. Also, we are trying to keep the look and feel as close as possible to the current user interface. Therefore, there will be no need for extensive training on how to use it. The solution should be very similar and also intuitive in order for you to successfully complete your submission using this user interface. Next slide, please. In terms of planned work for the next quarter, so for quarter 3, 2025, again, this will be very focused on the development of the new user interface. We are planning to start a UAT, so user acceptance testing, on the functionalities that are already developed in quarter 3, towards the end of quarter 3. Please note that the UAT will be only internal. We will be performing this UAT as the XEVMPD business team, and also we are involving the XEVMPD trainers. There will be no external UAT planned or required. Therefore, non-EMA and non-XEVMPD trainer users will not be involved in this UAT. As I mentioned before, the first phase of the UATs is planned for end of quarter 2023. We are currently focusing on developing functionalities which are available to industry users, so not EMA users at the moment, because you have priority, and we need to make sure that you as external users are able to submit your medicinal product information as soon as this user interface is available. This also leads to the need to update the documentation, such as the user manual, training presentation, step-by-step documentation, etc. Again, we will be starting to work on this update at the end of quarter 3 and throughout quarter 4, 2024. So as and when the new user interface is rolled out, this is foreseen for quarter 1, 2025. This documentation is already available to you, and you can look at this documentation and use it as a guide if needed. And last but not least, as my colleagues already advertised, to provide you with the opportunity to ask questions related to your XEVMPD submissions, we have already planned a few Q&A sessions, which will be on a monthly basis. You can see the dates of the XEVMPD ones on the screen. And this is in order for you to have the opportunity to have a live interaction between you and us, the business team, where we can hopefully help with the questions that you will be raising. Next slide, please. And just a quick summary of what has changed. As I mentioned previously, there was an amendment in the process of how you notify us of MA transfers approved after 1st January 2025. So it's not related to transfers that happened before this day. So please, only any MA transfers that were approved after 1st January 2025. You are now also able to submit authorized medicinal product composition as it is stated in Module 3 dossier or in SMPC if you wish to do so. New valid pending national phase marketing authorization status is available in the Article 57 database from January 2025. You can start using this MA value as well. And as you all might be aware, Windsor framework is in force from 1st January 2025. Our ongoing work includes the improvements related to cluster validation process for new authorized medicinal products. So this is not related to updated medicinal product information, however new only. We continue to provide mapping services to national competent authorities, And as mentioned, we are very heavily involved in the development of the new solution for the XEVMPD user interface. With regards to future changes, we will make sure that we have XEVMPD questions and answers available as articles in ServiceNow, therefore making it more easily accessible to you before you actually submit a ticket. You will not have to scroll through our PDF document published on the website. And we will start to review and update the documentation related to the upgraded user interface. And with regards to future changes, as my colleagues already mentioned, this is something that's related to the integration of the product validation with review of substances with SVG flag 0. We are planning on having the new upgraded user interface available to you from Q1 2026. And we also want to improve the process on cluster validation for updated AMPs. However, this is something that might still be subject to a change. I believe we can now go to the questions that we received, please. So the first one is the validation, which is the third acknowledgement of XEVMPD records are not consistent across records for the same product and registration. This is causing duplicate PMS IDs. Is it possible to group records together for validation to ensure consistency? So we're already trying to do our best with regards to newly submitted product entries. However, as I mentioned, the validation or cluster validation of products which were updated by you is not something we are performing as of now. Marcos, maybe would you like to?
Yeah, so as Veronica explained, what we are doing is we are validating in clusters. So products that belong to the same medicinal product in PMS, we are already validating those EV codes whenever they are inserted as new. It might happen that if you have an EV code that was already in XEVMPD, this EV code is not validated again as part of this cluster. It's only the new, the inserts. Also, Veronica explained we are trying to improve this validation process, including more clusters for updates, etc. So we are working to have this validation process as most harmonized as possible, so all these issues will disappear at some point. So we are aware of that and we are working on it.
Also, if you notice any inconsistencies related to the validation, please do submit a ticket through the ServiceNow so our colleagues can actually view the product and they can see if we can synchronize the validation. Thank you. Next question. In Article 57.2, the composition will no longer be included as indicated in the SMPC, but we will have to indicate according to Module 3. So I have already provided information on that, so you can still provide the composition as it is in the SMPC or as it is in Module 3, Section 3.2p1. If you do that, you need to ensure that you attach to the product entry the correct corresponding document. So either the extract of Module 3 or the SMPC. So our validation team has a document that they can check to ensure that the information is provided correctly. Next question, please.
Yeah, I think maybe that one is for me. So, there is a known issue on PMS for the products from XEVMPD that have an authorized dose form that is not from this specific list. This issue is that you are not able to see those products in the product UI. So, as we explained in the system demo, this issue has been solved for the insert, so that the bug is not longer happening. And now this week and next week, we will be doing the data fix for the products that are already impacted. So in principle, if everything goes as planned, by the end of next week, all the products that were impacted by this issue will be should be appearing in the product UI, but we will also send a notification to all the users so they can check when this data fix has been deployed.
Thank you, Marcos. Next question. Once the variation web-based EAF is approved, if XEV data is impacted, MAH should submit an update. What about data flows and which timeline would apply for this type of hydrovigilance XEVMPD updates? 30 calendar days since not yet applicable for initial marketing authorization. Well, variations are to be notified to the medicinal product entry in XEVMPD within 30 calendar days since the approval of the variation. I'm not entirely sure if I completely understand the question.
What I would answer to this question is that there is no change on any of the processes that were already implemented. So if there is a variation and there isn't, the XEVMPD data is updated, you have up to 30 calendar days. For new MAs, you still have 15 calendar days. In XEVMPD, also in chapter 3.2, it is stated that changes that are affecting like the authorization status, new MAs, etc., should be provided as soon as possible. So the data in PMS is also updated as soon as possible. And there are no delays on other procedures, mainly for centrally authorized products. So timelines are the same. We have not changed any process. It doesn't matter if you use the web-based EAF or the PDF EAF. You need to submit the data to XEVMPD whenever there is an update. Obviously, if you are delayed on the submission of those updates, PMS will not be updated until it's done, and therefore the web-based EAF will not be updated. So if you have new packages or changes, they will not be reflected until you are submitting the data to XEVMPD. Sorry.
Thank you very much, Marcos. Could you please clarify if the Article 57 database will be decommissioned in the future or if it will be updated as per IDMP requirements? So the plan is indeed to decommission XEVMPD as it was already advertised during the PMS Info Day. However, we still find it important that we upgrade this user interface to support the submission until such time the XEVMPD is decommissioned. Also, as you know, we will use PMS for the submission of authorized medicinal product data. However, sponsors might need to continue to use development medicinal product data, so unauthorized medicinal product data in the XEVMPD until we find a different solution or until PMS is also able to consume that data. And next question, we have several products with the same active substance. The SMPC lists identical indications for all of them. However, EMA has corrected the indications differently, even within the same product and PMS ID. What can we do to ensure consistent representation of indications in both XEVMPD and PMS?
So here we have the same suggestion as before. So when we receive inserts of new EV codes, we are validating those new EV codes in clusters. So we perform the same validation for all of them. If you see that these different EV codes are validated in a different way, then I would ask you to please raise a ticket so we can check those EV codes and we can amend the discrepancies if there are, discrepancies on the validation. So that is what we can tell. We are doing this cluster validation to avoid having these differences on the validations.
Thank you very much, Marcos. Next question. What is rationale behind enhancing EV Web when we are moving to PMS and XEVMPD getting decommissioned? I believe we have partially already answered it. Maybe Isabel, would you like to add something?
Just to repeat a little bit, like I mentioned in the PMS Info Day, yes, the intention is still to replace XEVMPD with PMS, but to fully decommission XEVMPD, there's a fair bit of work to be done, not only involving development products, but also involving repointing a few of the key systems of EMA and the network to use data from PMS instead. And we're talking of pharmacovigilance, PSURs, pharmacovigilance fees, clinical trials, CTIS, and a few other systems. So it's not something that will happen in the immediate future. In the meantime, what we've realized is for a few years, especially the user interface of EVWeb needs upgrades. We have these clunky workarounds with ActiveX that you need to download. We've heard those complaints. And so what we got from management is a small budget to do a minor upgrade. So don't expect a fancy revamp of XEVMPD. That's not what we're doing. We're just doing a minor update of the EVWeb so that you don't need that ActiveX solution, so that you can use the latest versions of the common internet browsers to do your submissions in XEVMPD, and that could carry us forward a little bit longer, particularly for development products for which we don't have an agreed roadmap at the moment. So the strategy still remains. We want to decommission XEVMPD. We want PMS to be the future database, but we're still on a journey to get there. And in the meantime, we still need to do minor upgrades and maintenance to all the solutions that we have in place to give users a slightly better user experience. And also to support what we're requesting you to do, which is to submit the packages or additional information to us.
Thank you, Isabel. Next question, please.
No, I think we are already delayed, so we need to move here.
Yeah. Oh. So we're now to PMS. We are nearly at the last stretch.
Okay, colleagues, I hope you can hear me now. Sorry, I was unmuted. So good morning, everyone. Today I'm going to present to you an update of the PMS project. As you know, PMS, in contrast with the other SPOR services, is still a project ongoing, fully active. So you might have heard already from XEVMPD colleagues what they're doing to support us on PMS, so data mapping from NCA side in terms of data management, data quality checkings, and so on. So for PMS at the moment, we are focusing on a bunch of activities, still very much focused on the next release and go lives that we still have to plan. But to start from the beginning, in terms of customer services, the PMS project has a team that is managing and handling the ServiceNow tickets submitted, either submitted as incidents or as a request for accessing API, PUI, or just a question to clarify. So we have a team in the back end, and we have launched this service since we went live. So we'll run through the whole years, and in future we'll stay active. We are aware that there is a backlog, so just for you, I know that some users might report in Slido, please follow up on this ticket or another. So please make sure you follow up in ServiceNow directly, because Marcos and I were presenting and we can't really follow up. Then still, in order to bring a bit more clarity in terms of what we're doing in PMS, we also have released an updated version of the FAQ and mostly the most raised questions. We are working also to release a new version of the question and answer, which we hope it can bring a bit more clarity, because usually during every webinar or every Q&A clinics that we have, we always receive a large amount of questions. So we plan to consolidate it all in a single document. Then, as you know, PMS is very active in monitoring, in terms of data quality, also the products that are subject to an update in view of the ESMP deadlines. So for critical medicines impacted by the ULCM list or even not. So we're keeping an eye on the amount of products that are getting updated, and we're trying to give the priority to any issue that we received in ServiceNow on these regards, because there are deadlines announced, and so the user are also have to respect it. In terms of improving the customer satisfaction and success, in terms of indeed documentation that we're releasing, the first bunch of documentation that we provided, and this is now available on the PMS webpage, and also on the PLM portal page, in case people are more confident in using PLM, they can look for it, or otherwise using just the PMS webpage. We have released the PMS data protection notice. This document is very much in line with the rest of the DPN documents released by RMS, OMS, and SMS. It basically explains to you how your the confidential data, most in particularly focusing on the personal identifiable informations, are managed and can be handled, not only from an EMA side, but also which are your rights in case you want to have access to your information. This document is now available, and then we have also focused very much in releasing an updated version of Chapter 2 and Chapter 3, as well as the PMS Q&A document. This is mostly because we have launched in January Q1 this year the functionality to submit updated information, even though a limited data sets in PUI, so there was the need to further provide clarification on these aspects. And even though a few versions of these documents we are also expected over the next quarter. Last but not least, what we have released, if I'm not mistaken, in May, we released the second version of the PMS Write API implementation guide. This is very much important for supporting the future API users in PMS. And also, as a little information, we are also planning to release an updated version in Q3. This is fresh from the press, just received this information last day. Throughout the whole Q3, we are releasing again Chapter 1, the SPOR onboarding is going to be updated, and also the Annex A to Chapter 5 is going to be updated. Actually, is already updated because I see that it was already in production. And this is basically focusing on giving information specifically on the read-only access that is now available in PUI, and I'm going to talk to you in a moment in the next slides. Then again, the work doesn't stop here. We still need to release in Q3 the data matrix Excel. So that's Excel file that is going to explain and give visibility on which PMS elements are going to be used or are currently used across the different applications. So not only in PLM, for PUI and EAF and API, but also for the ESMP. Then Chapter 4 is also very much awaited. This is going to be the chapter explaining the data quality, so how the data will be and the level of quality of products information will be handled and ensured in PMS. And also we are expecting, in view of the release of the public API, an updated version of Annex A to Chapter 5. Again, navigation guide will be updated because we are planning to release the bulk functionality into PUI very soon. In terms of project awareness and visibility, we have, as usual, a lot of events. Every month until the end of the year, we're going to host PMS dedicated Q&A clinics. Then we are always very much involved in Q&A, in system demo. Every quarter, you can join, you can register, and you can follow the progresses, not only for PMS, but also for many other systems that the agency is working on to deliver. Then we usually have, we had also in Q2 the PMS Info Day. For those who didn't join or didn't have the chance yet to follow the latest update, please have a look to the recording or the presentation. Everything is already available. Most importantly, how we are planning to modernize the PMS. So first of all, we are releasing the read-only PUI roles. I'm going to explain you in the next slide what is about and what's the difference with the current role that we have. Then, most importantly, end of Q3, we are planning to release the bulk functionality, so the possibility for registered users to submit products update in bulk via PMS PUI, but also in API. Currently, tests are ongoing, so that's why you can see to be confirmed, but we have very much, we are planning to release it by the end of Q3. Last but not least, we also need to release a bit more of functionality in terms of exports, in terms of in the public reports. Also, the possibility for the general public to access the public API. This is also very much in the radar. So the moment we have been working in making an analysis and design, and this quarter we will be focusing in implementing the solution, and hopefully in Q4 to be confirmed again, we can release the API, but most likely it could be also Q1. It depends how it goes. Now, in the next section slide, I will share with you what we have been focusing for this quarter. As I mentioned before, documentation of PMS updates. A lot of material has been now made available either in PMS webpage, on PLM portal, chapter 2, chapter 3, PMS Q&A. A lot of clarification in terms of bugs. So please, I saw in Slido many questions about how and when we're going to fix specific bugs or non-issue. Have a look, because the new version has been released in June 25, so recently. And then on top of that, due to lack of space, I couldn't enter also chapter 1, onboarding of SPOR user roles, and also the Annex A. This documentation will give you much more clearer set of information on how to use PMS, also how to register and which user role you can use. Then write PMS API version 2. In brackets, version 3 will come soon in July. It will give a much more clarification in terms of how to support the automation of the data submission and improve again the operational efficiency. This has been released in May 25, and it will be used to support the testing that are currently ongoing as of the 7th of July. PMS Info Day, I mentioned already, you can find the link. A lot of information and exchange have been mentioned, so please have a look. And then in the next slide, I will share with you what we are planning in Q3. I already anticipated to you that we have been working in releasing the read-only roles. Colleagues, if you don't mind, and you can just go to the next slide. Thank you. The industry read role is a new type of role that you can request if you want only to read the data. So the difference between the current user that you already have requested and this new one, which is the PUI industry read-all, is that there is you can decide to split to your staff whether you want to assign a user role just for reading purposes or also read and write. So you can find this new information in the chapter 1, SPOR onboarding user roles, and soon we're going to update also the PUI registration guide. Action for you, colleagues, from industry side. If you want to split these roles, the admin of each organization needs to review and redistribute the role permission as per the new roles available. And of course, you can rearrange this functionality. For those who currently have the same role as before, it means that you have the read and the write functionalities embedded. Then PLM data matrix, PMS data matrix file, I already mentioned to you. We want to bring a bit more clarity on which elements are supporting which application or systems. This is planned to be released. There is a little typo, it's not Q2, it's Q3. So I hope by end of July, this document will be available for you to access. And then most importantly, last but not least, the release of the right PMS API and PUI. I saw I saw Slido questions on when this is going to happen. The bulk update functionality in PUI and also the functionalities for submitting and editing products data in PMS API is currently under testing phase, and we plan to release in September this quarter, so this year. So we of course are very much working close to our testers. Most of them are also involved in both UAT, so we really hope to open it by September 2025. And in this case, you will be able to finally submit products data in bulk, in POI, but also in API. And then the system can straight away submit the most up-to-date information reflected also into PLM POI portal. And with that, I have the next slide, but this is just a summary of what I already mentioned. We did the data protection notice, a bunch of documents published, and also the PMS info days, very much awaited, the kickoff meetings for the test of Write API. And then what we are planning now to do is completing the is to release the POI industry user roles. This is expected, it's already in IAM production, but we noticed that there is a little problem with the characteristics and the approver. So I'm waiting for IAM and Iris team to fully launch the synchronization and fix that. And then also we will be focusing, as I said, in the running the UAT and releasing in production the PMS API and POI. The documents again are still on the radar, and then in the future, we are also planning to release to continue improve the data quality. This is something that will ongoing even in Q3. Release chapter 4 and working to open the public API. Also, in terms of updating R5 and XEVMPD submission and decommissioning, this is going to be happening in the a bit longer future. So please do not expect it by Q1 26. And with that, I think we have time for questions. Okay, first question, I think I already replied, but the PMS bulk update is expected to be released in production in September. So yes, we're still in Q3. We have made a plan because we recently had the programming interface event, and we have agreed that end of September, we should be able to release in production the bulk functionality in POI. Tests are still ongoing, of course. Unless we notice major blocker that we're not able to fix in August, the plan is expected to be respected. Next question, POI enrichment for pack size and MBO, manufacturer business operation. Change was completed on 26th of June, but not updated in POI on the 9th of July 25. Is it usual that it takes that long? And how can we follow up the performed changes? Do we get an acknowledgement for completion of PMS and display in POI? So colleagues, I don't know if you have opened a ticket in ServiceNow. I will really need to have more details, like the change ID number and
Veronica,
the PMS
sorry,
ID. But yeah,
I can reply to this one. Sorry, Veronica.
Maybe you know already.
So we have discovered yesterday this issue that if there is the regulated authorization has not been submitted with the change, so with the MBO, then there is a synchronization issue with Iris, and therefore this request is not shown in the product UI. Iris colleagues are going to fix this issue this week and next week. So all the changes that have been submitted for MBOs where the regulated authorization is missing, that will be solved by the end of next week. We just discovered this issue yesterday, and that's why we wanted to reply to all the tickets, and also we need to put a banner on the UI, but this will be fixed in the this week or next week. So sorry for the inconvenience on that.
Thank you, Marcos. I hope it's related to that. Okay, then next question. When is Chapter 3 expected to be updated to include the reintroduction, the high-level terms for MBO enrichment and the PMS? Maybe, Marcos, you want to take it because you had the discussions with the teams.
Yeah, I can also take this one. So we are waiting because there is a dependency with EAF team, and we need them to deploy a couple of changes on the way they are consuming this list, because EAF is also, the PDF EAF is also consuming this list. We are in contact with them, so as soon as we know when these changes are going to be implemented, we will be able to update the chapter, and we will hopefully be given the final instructions so everybody is aligned and understand how these terms can be provided in PMS. It's just we are waiting for this dependency to be confirmed and when they can implement those changes.
Thank you. Then next question. When is planned update for bulk update of manufacturer in BMS? So as I mentioned, plan September 2025. As there is already delay, will the deadline for end of 2025 be postponed? So colleagues, at the moment, there is no communication on the postponed deadlines. We are in contact with the ESMP team because they are the ones that needs to take a decision, and if anything will be agreed, and this will be announced at the quarterly, at the QSPR, so the quarterly strategic portfolio report event. But for the moment, we as a PMS team and product owner, we didn't receive any communication on that. Then next question, pack size enrichment. When will the PCID be assigned, and what is the difference between PCID and PMSID for pack size? Will the PCID change when a product, for instance, when a product is transferred from MAH1 to MAH2? So the PCID is not yet available, and it won't be until we are able to open the full data enrichment, because the generation of the PCID by PMS API system is depending from a bunch of elements that are not available and are not possible to be loaded either from SIMED or XEVMPD. So we need to open first the enrichment, and then in this way this can be assigned by PMS system. The difference between PCID and, I assume you wanted to mention, the PMS package ID, which is different from the PMS ID, is that the PCID can change over the time based on regulatory activities. You know, in chapter 2 there are a bunch of defining elements as per ISO DMP standards, and in this case, if you have, for instance, a variation at the level of the manufactured item because you change the form, this can change over the time during the life cycle. The PMS package ID, which is also reported in chapter 2, is a non-IDMP field, is basically a stable ID in the same way the PMS ID at medicinal product level is behaving, but is located at package ID. And this was necessary to be exposed because ESMP, for the scope of the ESMP report, shortage reporting, the users have to be in a good position to identify the package from PMS. So that's the difference. And I hope I have replied to your question. Then, XEVMPD. Dummy updates regarding match and merge issues with PMS are not working. Products are merged besides. For instance, differences, additional space in the medicinal product name. Is there a solution in progress? So, colleagues, dummy updates do not work for everything. So the fact that you don't see some data loaded from XEVMP to PMS, it doesn't mean that with a dummy update you can just fix it. It depends. In the PMS FAQ, we have explained when a dummy update can be helpful or not. So it really depends by the situation. I don't know, Marcus, if you want to add anything in terms of space in the medicinal product name, but it really depends.
Yeah, I think there is a bit of a mix here because match and merge is only for caps, and the name is not taken into account for the match and merge of caps. Then the second part of the question, it looks like it's related to non-caps. So it's a bit of a mix. But as Veronica said, dummy updates don't always work because maybe the issue is not on the on what you are trying to fix, or you need to make some investigation or at least open a ticket so we can also check if the update will work. Maybe the problem is that, I don't know, it's not all the products or not all the countries are using the name as a grouping element. So that is also something that we need to take into account. So yeah, we would need to investigate why it is not working properly. And maybe it's not working because it's not supposed to work. So that's the point.
If we have time for the next question, I see Isabel. No.
So I understand there's still lots of questions on PMS. I think most of the rest have been addressed. But before people start disappearing, please bear with me. I would like to do a few recaps of conclusions, what we've done so far. And also, of course, the usual, get your feedback on the webinar, and then we will pick up questions on PMS if time still remains. And if not, I do recommend you go to the monthly clinics. So moving on to the key highlights or the summary, because we've talked and covered a fair bit of ground today. So linking to the objectives that we wanted to achieve and what you heard about, our key focus still remains on delivering efficient regulatory data management services on SOR and also XEVMPD and PMS. And you heard many things. I will not recap all of them, but thought of bringing 2 points to your attention. So a key thank you to the Norwegian NCA for helping us with SMS translations. I think that's an excellent example, and we would only appreciate the effort and recommend more NCAs to do the same. So we now have validated substance translations in SMS. Another point to note is that we've started doing these yearly update summaries of ATC Human, ATC Vet, and scores. We're going to follow up with Vedra shortly, so that you see not only what changed, new terms that were added, but also the RMS IDs. And we hope this will facilitate the translation process of these changes as well. As I mentioned before, in the background, we are preparing to maintain and for the future of our data management processes via new tendering process. In terms of customer satisfaction and success, you heard right at the beginning of today a few actions we're taking to improve our engagement. So we're now launching these monthly clinics. So we realized today and always we never have time to cover all the questions. So now you will have monthly opportunities to ask those questions and hopefully they will be addressed. We have organized the SPOR information material and training material. So please bear with us. We're not running the week training session this year. Instead, you have webinars available. We will point you where relevant and only address questions. We were launching a new customer satisfaction survey on a quarterly basis. So that's the means for you to provide feedback to us. Of course, we read Slidos, we read in between the line, but the customer satisfaction survey is the formal vehicle for you to provide structured feedback on what you would like us to improve on. And we're also working on updated SMS, OMS, and PMS guidance, many different documents from the alternative names policy that we hope to start soon to all the documents to help PMS and the enrichment coming up soon. So lots of documents always published on a continuous basis. Now, in terms of modernizing our services, we've just concluded the IT knowledge transfer. So as part of our tendering process as well. And the first thing to point out with impact to people using the OMS API specifically is that we will deploy a new version of the OMS API on the 16th of July. You should have also received an email with further details, but very soon we will deploy a new version of the OMS API. We've started this minor XEVMPD user interface upgrade just to improve the browser experience. Nothing too major, significant there, but should facilitate the usage of the system. And you've heard also from Veronica that we are still pretty much working towards the bulk update and the PMS API being released in Q3. Again, linking to what we just said, the deadlines are not necessarily within our control to determine. We are discussing with ESMP colleagues what we can do and whether there could be a delay and what reassurances they need. And if there is a change in policy, that will be discussed first with industry in the quarterly strategic review event in September, and we will communicate widely and very likely at the next status update webinar as well, any information that we receive. So watch that space. So next quarterly status update webinar, we will communicate any work that we're working on, any changes of timelines, and any information we get. So this was the update of this quarter. In case you haven't been here in previous quarterly updates, I wanted to leave you with a few highlights of what we've done this year. So I will go into silence, but there's some sound. So it's just a recap of what we've done in SPOR up to now. So thank you for that. So I hope it was a quick recap of what we've been up to. We do have a few more minutes for question time. And in the meantime, have we selected the top unanswered questions? So I still see a few unanswered questions. So can we go back to Slido? Any last minute question, any unanswered question? We have about 5 minutes. No. Just a second. Yeah. So we have about 5 minutes for any outstanding questions, and then we will also launch a Slido poll. Feel free to answer or give us feedback on this particular webinar, anything we can improve before you leave. It's very important for us that you do provide feedback to us on what you'd like to hear next, what more details, how can we improve our engagement with you. So please. I don't know who's going to answer. Marcos, Veronica? It's still PMS questions, so no surprise.
I can. So for manufacturing operations start date, as per chapter 2, the conformance of manufacturing operations start date is conditional. However, in PMS PY, while reaching the manufacturer operations start date, conformance is mandatory. Please clarify. So yes, that's unfortunately is correct. Well, it's incorrect. PMS chapter 2 says conditional, but in PMS PY it was set up as mandatory, so we need to fix it and make it conditional. So this is the answer. Then I'll take the next one. Yeah, there is a disparity in chapter 3 versus chapter 2 IDMP definition for confidentiality indicator. Chapter 2 says only one MBO type, manufacturer responsible for batch certification, is public. Chapter 3 says, in addition to batch release, also the manufacturer of biological active substance is public. So yes, thank you actually for notifying this. So let me give you a bit of background. According to QRD templates, when you write down at the SMPC, you have two manufacturing business operation which are considered publicly available. These are indeed manufacturer responsible for batch certification, so batch release, and the manufacturer of biological active substance. So these were initially considered both publicly available also for PMS, but we realized that in PMS there is no way to identify whether a substance is biological by any field. So that's why you see that in Chapter 2, only manufacturer responsible for batch certification is by default set up as public, and Chapter 3 needs to be updated, reporting only this term. The other one, manufacturer for biological active substance, if you access POI and you try to submit this information, you will see that this is now, and the confidentiality indicator needs to be set up by the user. So you need to pay attention for that. You need to decide whether it should be public or confidential based on the fact of the substance that you have as active, whether it's biological or not. So we will be correcting Chapter 3. And thank you also for notifying this. Then, if two packaging are share a common MAA number, but with a slight formatting difference, first packaging contain MAA number 1234, and the second one is 2123 space 4. Please confirm whether this minor formatting discrepancy in MAA number would also result in multiple PMS ID or not. So. Maybe Marcus, you want to complement, but it depends by the authorization country, because not all, in all case scenario, the MAA number is a defining element for splitting PMS IDs. So maybe Marcus, you want to take it over?
Yeah, it depends on the country. Most of the countries, we don't consider the MA number at package level as a grouping element because you might have different MA numbers per package. So what we consider is, among other fields, the name, but not the MA number. You have all the explanations in chapter 7 and 9, which is the initial load and also the delta, so how we are grouping the products based on the different data elements.
Thank you. I assume this is for PMS. For non-caps, if we perform insert and update submission as a new packaging added and some existing packaging are already present in XEVMPD, difference in authorization status and rest of all information is the same. Will this lead to multiple PMS ID as we have seen for our products in PMS? Maybe Marcus, you can.
Yeah, I can also take this one. So in theory, it shouldn't, but as we already reflected in the Q&A document, there are some bugs that might be creating these duplicates. In Q3, you can also see that most of those bugs are planned to be solved in Q3, so during this quarter. So the idea is that we will get rid of all these duplicates and all the bugs that are making us having duplicates by the end of this quarter. So yeah, I would recommend you to have a look at the Q&A document and check if the issues that we have there are affecting some of the products that you have. But in theory, if only the authorization status is different, then it shouldn't be creating duplicates.
Thank you. So when will the document defining which lock ID to use for each regulatory authority will be published? So colleagues, fresh from the press, today I'm expecting this final document because our network product owner has kindly took over this activity because he had to contact each NCA to understand which one of the locks ID, if they have multiple lock ID, wants user to select. And I got this update just 1 hour ago, and I'm expecting this final document today. So if everything goes well, end of July will be there because we need to queue, and publication team at the agencies has usually a queue to respect. If we have time for another question, how can MAH possibly respect PMS enrichment deadline, so end of December 25, for unretrieved PMS ID and PMS duplicated records? Request EMA to kindly clarify the guidance. Thank you. Don't know, Marcus, if you want to, because I need to see what's the issue behind PMS IDs which are not retrievable and duplicates, which I think it will be fixed to Q3. It depends by the issues.
Yeah, so again, we are working this quarter to make sure that all these products that are not able to be found in the product UI because of the two different bugs that we had will be available, and we are also working on these duplicates. Now, the the deadline for the submission or the enrichment of these products, we are going to also discuss with the ESMP colleagues, because at the end they are the ones that are requesting the data and they will be using the data. So we need to get into an agreement if there is a possibility for any delay on this deadline, and we will communicate. Veronica already make reference to this, that we will be communicating this to industry in the respective forum. So please bear with us. We need to discuss with them, and then we will come back to you with an answer.
And I'm afraid we have another PMS question, so sorry for colleagues. For non-caps, both concentration required and presentation strength not required are present under the PHP, pharmaceutical medicinal product. Our understanding is that only one type of strength, either concentration or presentation strength, should be included. Is it non-issue and able to find in FAQ, or should we raise a ticket to remove presentation strength? So let me give you a bit of background. In PMS, indeed, the substance composition can be either expressed in a concentration as a concentration strength or presentation strength. And so there are some cases when you might need to submit both of the type of strength, either concentration and presentation. This is deviating a bit from IDMP because we noticed that in real life case scenario of products authorized, and you can find in chapter 8 a lot of examples, sometimes you are requested to submit both of the strengths type. So it's not an issue. We left as conditional conformance both type of strengths because it might depend by the type of authorized products. So if you have this kind of information are coming from XEVMPD in this case into PMS. So if you have noticed that the XEVMPD data are not reflected correctly into PMS, API or POI, okay, you can raise a ticket and we can investigate, make sure that the delta has been working correctly. Otherwise, this is the rationale why you see one or the other type of strength, or even both. And then we have time for another question, I guess.
No, Veronica. So if we can now launch the Slido poll for feedback. So please bear with us. In the last 1 minute before you disappear, we would appreciate if you could leave us some feedback of how we run this webinar. I'm already looking at some of the feedback. Please know we never have time for all the questions, and for those reasons we have created these monthly Q&A sessions. Those would be the sessions really just for questions. We will still maintain these sessions just to give you a bit heads up of the main topics we're working on, and keep a little bit of Q&A time, but of course it's not the main purpose. The questions only would be on the clinics. But in terms of how we run this webinar, so if you give us feedback on how did you think the structure went, were the topics clear, would you like to see any dedicated topic being further elaborated, we would really appreciate feedback on that so we can take it on board for subsequent webinars. So please give us feedback on that. Any gap that you think in terms of information, and we will try to address it in the next opportunity. So thank you very much for joining us today. We will leave the Slido open and looking forward to see you on the monthly clinics.